Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Right. So this is the clavicle. This bone is actually a clavicle bone which is present, which is a long bone, and it is present horizontally in our body, and it is present subcutaneously, and it has no medullary canal. It has two ossification centers. There are two primary ossification centers and one secondary ossification centers is present for the clavicle. So in the clavicle, there is two ossification centers are present. One primary ossification center and the other two primary ossification centers and one secondary ossification center is seen. And this does not follow enchondral ossification. Okay, this clavicle does not follow enchondral ossification, so it follows intramembranous ossification. Though it is a long bone, it does not follow enchondral ossification, but it follows membranous ossification. Actually, most of the long bones will follow the enchondral ossification, but this clavicle will follow membranous or intramembranous ossification. So it is a horizontal bone with subcutaneous bone with no medullary canal. So if you see, the fracture of clavicle is the most common. Fracture of clavicle is actually the most common fracture in newborns.
thank you and thank you for watching.